I'm Dr. Patricia Johnson. I'm a doctor of audiology as well as an assistant clinical professor at the UNC School of Medicine. I did my undergraduate at the University of Washington in Seattle, a Bachelor's of Science in Communication Disorders, and then you go on to a 4-year doctorate degree, which I did at Carolina. My favorite thing about being an audiologist is being able to identify what that patient's concerns are with their communication, which in many ways can be actually very personal. It can be emotional at times, and how it's impacting their relationships, the people that they love most, as well as their quality of life. And then put together a treatment plan. It may or may not involve hearing aids, but to give them strategies and tools to communicate better. My day may vary. I will have hearing tests where we're meeting someone who's being diagnosed with loss for the very first time or suspects that they might have a hearing loss. We then also do tinnitus evaluations, and if hearing aids are indicated, the selection, fitting, programming, repair, and modification of hearing aids as well. And if I'm lucky, I also get to do wax removals if that's needed. I find wax removals to be very satisfying because someone comes in with a very specific concern. I think something's in my ear, and we're able to remove it safely and cleanly and know that that wax is not going to impact their hearing any further. Tinnitus is the perception of sound even when there is no external source to that sound. A lot of folks with tinnitus have been told by well-meaning people, there's nothing you can do, you just need to live with it. And that is not particularly comforting if it's actually a source of anxiety for you. But just because there's not a cure doesn't mean that there aren't really meaningful ways to control and manage someone's experience with tinnitus. I really love hearing aids. I get to teach some of the courses on hearing aid technology in our doctoral program, and I find that hearing aids is such an interesting mix of healthcare and technology and electrical engineering, but they're a powerful tool. Those computer chips can be modified and adjusted for every patient. And because the technology moves so quickly, I find that it forces me to stay really informed and really up to the minute sometimes about what's coming out, what is just available, so that I can offer that information to both my students and my patients. I think it's important that the care be very patient-centered, very patient-driven, that we as a provider are listening to what our patient is telling us. I'm always going to give my patients a straight answer, an answer that is based on research, so that we can move forward with what they need. So that's a real mission of our center here, is that we are interacting with our community at large, but also acting as a source of reliable and trustworthy information for anyone who's looking for hearing care. I'm in and around the triangle with these different community presentations, so I hope that if you see me at any point in your local library or in one of the retirement communities, that you would come and say hi to me. I'd love to meet you and learn more about your hearing journey.